Good afternoon. Welcome to the EMA office for day 411. I'm joined with Assistant Director Brian Whitaker and Chairman Mark Hearn. And Brian, you've got the numbers from the Health Department today.
Yes, sir. In St. Clair County, we've tested 337,830, which is an increase of 944 since yesterday. Positive test results are 30,354, which is an increase of 25 since yesterday. Those are males and females under the age of 10 up to their 80s, and that brings our daily county positivity to 2.6%. For negative test results, we're at 307,485. Sadly, we are announcing an additional COVID-19 related death in St. Clair County, bringing our total to 476. And that was a female in her 60s, and she did have underlying health conditions. Our sympathies go out to her family. For those that have completed the IDPH required 10-day isolation period, we're at 29,539. For state totals, they've tested 22,469,213. Positive test results of 1,328,454, which is an increase of 2,728. The state is announcing 33 additional COVID-19 related deaths, bringing the statewide death total to 21,891. For hospitalization numbers, those hospitalized in St. Clair County hospitals, we have 22 patients admitted due to COVID-related illness, and 2 of those patients are on ventilators. Regionally, there are 43 patients admitted due to COVID-related illness, with 3 of those patients on ventilators. For our congregate living facilities, previously or currently in outbreak status, we'll only announce changes since yesterday. The Marquet Nursing and Rehab Center has 35 cases and 3 deaths, which is an increase of 1 case for that facility. As we discuss on here every day, testing is still so vitally important. If you feel like you've been exposed or displaying any symptom of COVID-19, it's important that you get tested so you can be isolated if you are positive to help lessen the risk of spreading that virus to others. Testing is available Monday, Wednesday, Friday, and Saturday at St. Clair Square from 8 a.m. to 4 p.m. and at various pharmacies and urgent care centers throughout the county. I'll turn it over to the chairman for his update.
Thanks, Brian. We got an update today on the bridge phase and how soon it might be that things can start to open up a little more in the county.
There was an announcement today that IDPH is in the final stages of monitoring the last 28-day cycle to see if, as a state, we're going to meet the criteria to move into the bridge phase. They're expecting a decision to be made in the next 5 to 6 days. And if we do, we will move into the bridge phase, which gives even a little bit more opening of some of those larger facilities, larger gatherings, a little more percentages in retail and dining and stuff like that. And then if we stay there for 28 days, the next step out of that is phase 5, which is a full reopening.
Great. So we're getting there.
We're getting a lot closer. We'll expect that decision in 5 to 6 days from IDPH on moving into the bridge, and the bridge lasts no less than 28 days.
Okay, thank you. Well, let's take a look at the zip codes. 62201 up 1 to 603. 62203 up 1 to 660. 62206 up 1 to 1,383. 62208 up 2 to 1713. 62220 up 3 to 2,169. 62221 up 2 to 2,904. 62223 up 2 to 1,841. 62226 up 3 to 3,327. 62232 up 1 to 933. 62243 up 1 to 802, and 62269 up 4 to 3,394. 25 new positives today, 944 people tested, brings our county positivity up today to 2.6%, still a good number. The rolling average then goes down to 4.2%, and regional positivity remains at 2.5%. The regional positivity is derived by the fact that Bond County called in at 0.7%, Clinton 3%, Madison, 3.8%. Monroe, 3.2%. Randolph's at 1%. St. Clair is at 2.2%. And Washington County doubles us at 4.4%. Herb, I think looking at these daily stats today, 22 out of 25 of the new COVID positives are people under the age of 40. It really says a lot to who we still need to get the message to, that people need to get vaccinated. It's those really under 40 that are the ones now that are most vulnerable. We only had 2 in their 50s and 1 person in their 80s. It shows that because these people are vaccinated, that's why we're seeing a chart like this. In the early days, the chart was exactly the opposite.
Exactly, and I know you and Brian was talking about the announcement that was made today, and we're going to be watching that each and every day over the next 5 to 6 days. But, I'm always the one that is skeptical. We've got a holiday coming up, Memorial Day, with that 28-day that Brian mentioned. That scares me, because when you look at those stats that you're talking about right there, it's that younger population that for some reason hasn't done enough research, or they just don't care. But when you're having 25 new cases and 22 of them under the age of 40, that's an alarming rate. So for Team St. Clair, you hear the numbers every day. They don't lie. We get them hot from the health department. We continue to watch the hospitalizations, and we've got to get all those numbers have got to gel together. We're close. I mean, we're closer than we've ever been.
The new guidance from CDC says that if you're vaccinated, being outside and being with people as long as you're not packed in groups at parades or festivals, those type of things, you don't even need to wear a mask if you have been vaccinated. Many of you have seen that chart. If not, go on CDC website and look at the chart. And it makes it clear that the people who are going to be able to get back to their lives as they were 411 days ago are those who are vaccinated. Those who aren't, the recommendations are still going to be there to social distance. And of course, everybody, we need to continue to wash our hands. That's something that through this pandemic, no matter how long it is when we get out of it, we need to not only be doing it now, but let's continue the hand washing and the hygiene part of this thing, because it makes a lot of sense, not just during a pandemic, but really forever.
Well, and as we said, each day, we have made it as simple as possible to get the vaccination. And as I said yesterday, we talked about it. If those of you who haven't made your mind up yet, continue to do your research. But, there's going to come a time when the mass site's going to shut down. Then you're going to be wondering, well, where can I go get the shot at it? Am I going to have to go to the local drugstore? Am I going to have to go to my physician? Right now, it is easy every day, but today, we were closed today to do our housekeeping down there, but they'll be opened up tomorrow. We encourage you can make the call for the call center. They're still operating to help you. Or 9 to 5, you can drive down there and sign up and get it done, and it's just that simple. But there is going to come a time that mass site is not going to be there, and it's so easy right now.
We've been vaccinated. I was vaccinated at the mass site. My family's been vaccinated. Everything has gone very smoothly, and now everyone is immune. We can gather again. We don't have to. I took my mom to an appointment today, and she's watching, I hope. And
Hi, Mom.
We didn't have to wear masks in the car. We were, we're all in the family unit, and
this is what we've all been working for.
It was just like 411 days ago.
Yeah, we're all wanting to get this behind us, and whatever that new normal is going to be, but we've all got to continue to do it. As Brian said, we're going to be watching over the next 5 to 6 days, watching those numbers. We get into that bridge part of it, that's even going to open up more, and then we can all sit here and say, yeah, it was a rough ride for whatever that last day is, that we get to sit here and say, you don't have to see us anymore every afternoon. We're waiting for that day, believe me. But until then, we're going to be here because it's important that we continue to bring those numbers to you and continue to let you know how important it is to our citizens. We lost another citizen overnight. Up to 476 of our county residents are not with us any longer. We don't want to lose anymore, and we can all help be a part of that solution by getting the vaccine and to where we can get this all behind us. We don't have Cindy with us today. She's got other work she's doing, but we will be back tomorrow for day 412, and we'll see everybody here tomorrow afternoon. Have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this daily virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.